allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please join me with a word of prayer. Lord, we ask you to bless this meeting, guide and direct us in all things. We appreciate your presence and your guidance. All these things we pray in your precious name. Amen. Amen. Everybody has the agenda. At this point, we need to review the agenda and approve the agenda for the meeting. So, any changes to the agenda?
Make a motion to approve the agenda.
Oh, you're going over there. We have a motion.
Second.
Here's a second.
Yeah.
Okay, second. Discussion. All in favor, aye.
Aye.
All opposed, same sign. All not voting. Okay, motion carries.
You gonna forget me?
We're moving on down the road here. All right, folks, everybody had a chance to take a look at the last meeting minutes. Please take a look at the minutes or changes to minutes from last meeting. Any correction? You seen that? I call for a motion to approve the minutes from last meeting.
I'm over to take the minutes.
Okay, we have a motion.
Second.
Have a second. Discussion, all in favor, aye.
Aye.
All opposed, all not voting. Motion carried. One of the most important things we can do is look at the bills. So let's move down to item number 4, approval of the bill. Please direct your questions about the bills to Ms. Deborah. Any questions about the bills?
Oh, that's like zero.
It's early in the month. The bill hasn't come in yet.
Oh, which couple of.
Yeah,
them
there's probably some
Oh, legal fee.
that we'll have to get to
Yeah,
this later.
just early. Motion to approve.
I'll second.
Okay,
Motion.
we have a motion and a second to approve the bills, monthly bills. Discussion. Seeing none, all in favor, aye.
Aye.
All opposed, not voting. Motion carried. All right, moving down to item number 6.
All right, so we were supposed to find out yesterday on the said grant that we had submitted, but the state pushed it back and we don't know when they're gonna announce that. They didn't give us a new date, so just waiting on that. A little bit of delay on Dan starting. He's got to wrap some stuff up at the city, so he's going to be doing some just sort of part-time continually for now. And then working the full-time later unless that grant comes through sooner.
Good luck, Karen.
We attended, I attended with a couple of the nurses, the Lions Club eye vision screening. They had 76 people there that day, and we were doing flu shots and blood sugars and blood pressures. We also had several Lincoln students, nursing students that came in. So it was pretty packed. It was really cool to see how their clinic worked. I'd never been to one, but they actually have eyeglasses there that they provide them with at their appointment. So it was really neat to watch that. And of course, Wanda will probably talk about, I don't know their numbers, but they were Pete's Day the same day in Richland with COMC. I assisted the chamber with the Veterans Day parade and the work that day. Attended the chamber luncheon. Just moving into, wasn't quite as busy a month for me after getting the grant in, just kind of getting end of the year things wrapped up, and invoicing. The state has showed that they approved some of those invoices. They're just still waiting. They're just slow to pay. Gary's been watching it, so.
So they're still behind.
Yeah, the state's still behind. So not sure what's going on there, but hopefully one of these days they catch up. What else we have? About it. We'll be closed Thanksgiving Day and the Friday after. It's the day we normally get, but also the governor declared it a holiday this year. We do our Friendsgiving, just having a potluck lunch on next Monday here during our normal lunchtime. I will be attending on December 9th and 10th, a government public health summit at Old Kinderhook at the lake. It's a new one that they have, and so interested to see. There's a required training we have, or it's part of our core incentive funding that I have to attend that. So we did move staff meeting back a week in December from what we normally have.
Was that a state or a national convention?
State.
Okay.
Yeah, it's the one the state puts on. But it's a brand new one, so it's something that I haven't been to. Hopefully it's good. Staff meeting will hit on the 16th next month. And then we have our closure on Wednesday, the 24th, Thursday, the 25th, for the Christmas holiday.
You did say the 16th December?
Yes, it's staff meeting.
Good. All right, Deborah, what else?
All I've got.
Hey, guys.
I'll have budget to you guys next month for fiscal year 26 and our holiday meeting closures.
Very good. Any questions? Our director. All right. Deborah, we thank you. Guys, move down to public health. Let's Wanda.
Been actively giving flu shots for the last month and a half. So we have surpassed what we did last year. We did 189 flu shots last month, and we've already done a lot more than that, but we are well over the allotment that we had last year. So those numbers are improving. Like I said, we've been doing different clinics throughout. We did all of the senior centers. The eye clinic thing that they did, we've done City Robert every year. And then of course we have, our doors are open Monday through Friday. And so we have our normal clientele, but we've definitely increased on that, partially because we're probably the only ones who are giving COVID vaccines in the area. So those who want both flu and COVID almost always come here. And we're prepared to. And they had.
What was that?
COMC had a PEDS day, pediatric. So their request for us is that we provide them with pediatric vaccines. This is not necessarily the right time of year for most people to think about pediatric vaccines, or they've been to the doctor. So,
Was this in Richland?
yeah, it was at the Baptist Church in Richland on the 8th. So, but we had a good time talking to all the people and seeing all the kids come through. And we had a lot of stuff for WIC there too, so that they could, we promoted the WIC as well as our public health. Talked to a couple of the doctors who were working or volunteering their hours there at the clinic, and kind of went over some of the things that we do, some of what we have available. So it was a nice thing to be, in conjunction with COMC too. Birth certificates were like way down last month. Our death certificates were down to 35. It was like, oh my gosh. Like I've seen that low.
Yeah, that's really
Yeah. But continuing to do, blood draws are a big draw for us here because we can get it to people for a low cost. Our foot care clinics are still packed full. And as you can see, when it comes down to the immunizations and stuff like that, it's flu season, so our flu shot season. So we're pretty hyped up on those. Still doing lots of STI and STD testing. Fortunately,
We don't.
testing does not equal active cases, so we're not seeing. We only treated one last month, so that's good because we were treating like 3 to 4 syphilis a month for a while, but that's down. So that's pretty much all I've got right now.
So on the TB testing, Wanda, what
Huh?
is that? And we had like 9 right here. Is that kind of in the average range or is that up or down?
Well, we'll have differing things, and when they had the 19 in April, that's all of us.
Sure.
Okay, so, back to school time, a lot of times you're gonna see a lot because the different people starting, anybody starting into a healthcare program has to get a TB test done before they can start those programs. A lot of doctors' offices don't offer them, so the health departments are their primary place to go and get TB testing done. Of course, we do, the Waynesville Career Center, we take care of all of their students for their CNA programs and stuff like that. So we stay pretty stable on
So this is
that.
kind of a routine test for some, like there's not because there's an outbreak someplace, right?
No, these are tests. Generally, they have to do with somebody going into the healthcare field or their annual test. We still do, we do annual
Daycare.
testing for a lot of, for DOC. We do all of their probation and parole officers and things like that. They send them all here for us to do their testing. So food service and healthcare workers are the only people that are still mandated to have a test at least every 2 years.
Good.
Everything has got a number on it, or something. What is
The PE card?
the P?
Oh, that's
Yeah,
what they- that's
it's
what they
0
got.
all the way across. What's,
Those are temporary Medicaid cards, and we used to do a whole lot of them until last year they changed how we do things. And we can still do them, but there's a lot more involved in that. And so we have not done a lot of those. Doctors can now do those.
We were
Used to,
we were doing very
up
few
until
because the
until
doctors could do
November
it,
of
so they
last
just knew when to
year,
stop. Yeah,
so
we did them
we
like
don't even
crazy.
mess with them anymore. Should.
not really.
Um, we did a lot of them up until November of last year, but then they added a piece. The doctors couldn't increase a person's Medicaid when they became pregnant. So they had to come to us and get a note that said they were pregnant and that they needed Medicaid for pregnant women. Now, and they've decided that a doctor, and honestly, it's the best place to go is to the doctor's office to get your first prenatal examination and find out that you're pregnant and get started on prenatal care immediately. So that's when they decided, oh yeah, the doctors can now tell you. So
Lightened up a little.
So it's an inconvenience for them to come here when the doctor can do it where they're already going anyway. So while we can do them, we get.
I'll remove that most likely in January, so it won't be there unless we start doing a whole bunch.
Unless they change something, but I doubt it.
Well, it's a really good snapshot here of what's been going on. So we appreciate that.
I did add a line. It wasn't on you if you're looking at last month's. I added the nursing only piece because it's another section. And those are things that we do, like giving, they'll have a doctor's order for an injection and a shot. And so we put that under just nursing only. They come in with their prescription and their bottle, and we give them like a B12 shot, or somebody could bring us, if they don't want to inject themselves with something, they can bring it to us and we can inject them like penicillin.
I'd like to see the adult, the no insurance, that went way up.
The adult with no insurance, I'll be honest with you, that had to do with a clinic that we held literally for flu shots for
Okay.
people who did not have any insurance. We encouraged them to come and get shots.
Great.
So
It's
yeah,
easy to see, isn't it?
Yeah, no kidding.
That outlier, yeah. What did you do? Oh, this is what we did. Yeah, good action.
Mhm.
All right. What else?
that's all I have.
What's any questions for Wanda? All right, thank you. Appreciate that. Moving down, let's need a quick report.
Well, our count from September was 1121 and October's was 1101. It went down a little bit, but we're always fluctuating depending on who shows up for appointments, weather, incorporated into that. Some of them is that mom it goes off once baby turns 6 months old. So that's that. The funding for WIC is through 2026. We're not going to be in the continuing resolution. They fully funded it when they signed it. So
About time did that.
yes, that is very good news. We're not going to have to worry again or stress or anything about that. So WIC is taken care of. The other thing is we started Spirit Web, which is a new operating system for WIC that the state went to on Monday, and it's been a very stressful 3 days for the staff. One of the main issues is the system times out after 30 minutes if you don't hit save. And so what happens is if we're working in a chart and somebody calls and we try to go and schedule that person, it's going to time us out because we have to hit save to keep ourselves logged in. And that is not changing. The state is not going to change that in the system. It's built in. So it's very frustrating. You're right in the middle of taking care of somebody and it logs you out. You log back in, you have to find the person again and start all over. So, yeah, it's very frustrating for us. And so we had that happen quite a bit. And it's going to continue to happen. And the scheduler is very slow. It circles. That is the slowest piece. We can do the appointment faster than we can schedule an appointment. So that doesn't help with the logging out. So yeah.
And then internet's down today on top of it.
Yeah, and internet's down on top of
When I
that.
got here this morning, everybody goes, well, no phone, no internet.
Is that change FTEs? Is that
Yeah, we
change?
called it in.
Are
They
you
had
seeing an
some
increase in
outages.
time?
Does that happen more than once?
Not very often.
I could schedule it,
I've heard it.
actually.
Did you
So
have
you're
a?
seeing an increase in time.
And you have to sign back in.
Oh, okay. We do have a backup hotspot through FirstNet that we
Yeah,
can
'cause
keep
that's
a
some
couple
stuff
things up.
that you could almost.
So Wick is saying up, they have a computer up, but we do have a backup hotspot. It just doesn't run everything.
Yeah, and they, with that, they did a webinar we started on Monday and at 4 to 5, they did a webinar to have people, talk about glitches, which that was one of the things that everybody said, are you going to change this? And they said, no, hit the save button, hit the save button. Well, you don't hit the save button when you schedule somebody.
You're just talking about deviation and FTEs.
Yeah, that is our
If it
hardest.
normally took you 30 minutes, now it takes you 45 minutes. You have the same amount.
It'll affect how many they can schedule in a day.
And that is, we're looking at that and we've, and it all comes down to the scheduler. I don't know if there's a few things they're gonna adjust, but they went into this transition and sent us a guide of things that don't work.
Yeah.
That's nice.
Here's what we've seen.
Yeah, things that don't work. And I'm like, okay, then why did we even start this? The things are not working.
Did they pilot it anywhere this time? Or they
They
just hit
said
everybody at
they
one
did,
time?
but they didn't. And the other problem we had is we had to learn it all on the web. They put out web training. They didn't do any in person. They did all web. And so that's the frustrating part is we didn't physically have a person, and some of us that are older don't learn that way. I'd have been better with to sit down with somebody and they had the system up and they went through it. They had a sandbox where you could go in and play in the system, but not the scheduler part of it. Because it would have affected the clinic that we had. So we didn't get to play with that. So we had to learn all of that the first day, and that's the hardest part.
Is there a bot attached to ask questions?
No.
Okay. Because most systems you see now all have a bot attached.
Yeah, and they didn't do that either. So the thing is I don't.
Understood. This is 3 years ago program.
Well,
It's purchased from another state that didn't like it either, but.
actually, Israel, what this is.
The truth comes out.
Well,
The base version of what they had.
It's a Missouri way of doing
no, it's not. What it is it's a web-based system. And they want all states to go to a web-based system. And so we can communicate state to state, and FDA or USDA can pull it up and look at everybody's. So Spirit was actually in Oklahoma, and there's lots of other states doing it. And at some point, we will be able to go and click in another state's agency or state in their state and pull information from a client.
For transfers.
But out of
Mhm.
curiosity,
I see it.
if Missouri bought it, and I know you wouldn't know why this happened, what did Oklahoma go to when they sold it? If it, they're.
They didn't.
No, it's an
Oh, they
adoption.
still
It's
have
going
it.
nationwide.
It's going nationwide
adopting
is what
it,
it
so
is. What happened is Oklahoma had Spirit first. We based our wins on theirs and wrote our own program.
I
Well,
see.
now we've backtracked to do this web base.
I see.
So actually it was whenever they did it initially, we had somebody at the state who was a programmer and she went and looked at theirs and she come back and she did the program. Well, after 5 years, she left. So nobody's really known how to run wins except us really well because we piloted it and she trained us.
Yeah, and you just don't know how to fix it now.
Yeah. So, and there's really, like I said, they're relying on a third party to fix things.
Yeah, absolutely.
So it's, yeah, a little frustrating, but that's where this is going, is through web-based. And so it's going so that the feds will have access also to what we see.
Stuff.
So
USDA has clunky systems.
they do.
Where crop reporting and all that's really clunky. USDA
So,
system.
yeah, it's going to that. And I think I was going to go look this morning before I got in here, but I know there's a federal regulation that says all states have to be web-based by a certain year.
Mhm.
But I couldn't get back in there to look. It's been too long and I can't remember. I did know what it was, but I couldn't remember. But there is
There's a
there is
deadline.
a deadline for the web base. So, but anyway, and so I know that we have next Thursday and Friday off, but my staff is also taking Wednesday off. We're gonna need it by next week. We are, like I said, we don't learn very well with the web things. And we did all of them, but they just didn't have enough information.
We understand Debbie Franks.
You know, we had that same complaint when we
Right,
were
Debbie.
rural care, and we
So-
actually
Well,
did talk them into doing
Because Debbie never,
some
They like seeded classes.
Debbie never wanted a computer.
in-person trainings because it was not good.
Well, and so many glitches, that's the problem. They're sending us a transition guide that has so many glitches and they already know it, and there's things they didn't tell us. So anyway, that's where we're at.
So Anita, sometimes when you start looking at online training, they try to take a in-person curriculum and then apply that to an online learning curriculum, and it doesn't.
Where you can't,
Yeah,
you can't
there's no
interact.
yeah.
Yeah, that's weird.
And so that's a real challenge. And
It is.
It's not about a matter of age, I don't think. It's just a matter of how the curriculum was set up and how they didn't fully test it and all that stuff. So.
And that's very true. That's some of it. I mean, like I said, we piloted wins. This is based on it. So it's just a few things are different with it. So
It's not
And
working.
hitting that save
It
button
did.
every time the thinking is a
Oh,
pain
that's
in
what
the
you have to
neck.
do.
Mhm.
Yeah,
And it's a
I'm gonna
process.
save this for talking. I'm saving talking.
Yeah, but that's the problem. Some of the screens don't have that button to hit, and we haven't figured out how to do that in the process to keep that up and running.
Gotcha.
So it's very frustrating, especially on the phone. We have to apologize to
Well, I know-
people because we're waiting because we might have to log back in, and it's circling
That's
and
And our staff's been doing this so long, they were really, really fast, so we had limited time in the rooms with them, to get them in and out as quick as possible. Now they have to do everything when they're in the room, so before Anita could wait till she was done with education and get them on the road, and then she could document after, and now she's having to do it within the room, so their appointment times are gonna take longer, and there's nothing we can do about it.
And I hate to say it, but that's happening everywhere in the federal system too. Like at Fort Leonard Wood, they have to have them while they're right there. They can't just go in and put their notes in later.
yeah,
They
and
have to do it
They
right
have to do
there.
it right then. and
Yeah,
So
and
the,
It's the
so
same
the,
system.
so the clients are having to wait
Exactly.
to be able to finish up and do their.
I will say though, the web-based is easier to type in, so I can
That's
get
good.
things done a lot faster, but
So maybe if they get the glitches fixed, it'll be better.
Hurry up and wait.
exactly. But anyway, that's all that I have. Thank you.
So, Anita, I have a question for you.
Yeah.
Tell us about the impact of the shutdown on our, clientele. Because one of the things that, we've always worried about is taking care of our, folks and that are in the programs. So was there a huge impact, or kind of fill us in on how that went?
There wasn't so much of an impact. We did have to call and get clarification in case somebody called and wasn't getting paid, how we were going to do that process to put them on WIC. So we got clarification on how we were supposed to do that, income wise, because we're based on income. So we did take care of that. I called and the state gave me the guidance on that. We didn't have anybody call because we look at previous month's income. So some of them got half pay in October. Had it went through November, then yes, next month would have been.
So it was getting down to critical mass.
It was.
We
It was
could-
getting down to
Or we
critical
could
mass for
temporarily put them on
us.
for a month because
Yes.
they would have qualified for that month previously. But
So it was getting to, yeah, we were,
getting close.
yeah, getting close where we might have to do a lot more and our business. But anyway.
So things are getting back to normal now with
Yes.
the funding and
Yeah, and I'm glad that they put us in that, that we're okay for the next year. We don't have to worry about that again.
so did we have to furlough anybody or,
No.
you know?
No, the state came up with enough money that they didn't pause
They did.
benefits and they left their operations budget open. And
Mhm.
so the state staff were safe and so were locals.
Yes.
Yeah.
Great.
Well, it's all about taking care of folks and,
Mhm.
and, we're glad that it worked out, but it was getting
It was getting, yes.
pretty critical. All right, other questions? All right. Ms. Neat, we thank you. Moving down to number 8, PH report. Ms. Karen.
Morning, everybody. We actually, numbers were a little down in October, but at the end of October, we were doing some training on food safety, which we actually got that implemented and going. But we had 36 routine health inspections, 14 follow-ups, 3 new facilities opened, had 9 consultations and 4 food complaints and 1 temporary event and 1 lodging complaint. We also had 2 sewer consultations, 2 child cares inspections, 17 water samplings that we had for the month of October. And then we attended 10 trainings and most of those were webinars. 2 food recalls, which resulted in 17 follow-ups, excuse me. And we had 2 emergency responses. One was a semi through Burger King and then Sleep Inn had a dryer fire. So not too bad for the month of October. We did talk about the water lab last month. So I did look into that. To get certified, the annual fee would be like $500 for the certification. And then I did talk to Pulaski County. They don't really make any money off of official samples at all.
Do they do it?
Yes. But all cities, as long as they pay their provisional fee to DNR, all their samples are free. So their monthly sampling.
That's not necessarily true.
That's what the city of St. Robert told me when I talked to
I just
them.
talked to Steve too. I don't know who you talked to, but that's not necessarily true.
I talked to Scott and he did tell me that if they done it through the private lab out of Raleigh, which they do their main breaks, is $50 a sample.
Yep.
And it costs them $1,500 a month versus going through DNR or the state lab, which is $0. But he did say that they would use us on the main breaks and would be willing to pay $50 for each sample for that.
I talked to, yep. Texas County, she would. And Laclede, Mitch and Larson boy, and they said they would too. So
I could see the main breaks.
Yep.
I don't think we'll be getting.
they get charged for it. It's primacy fee.
Yeah.
And all that primacy fee, every public water system charges that back to the customer.
Because that determine, based on their population and.
I think one benefit in that,
Connection.
I could see is when there
The main
are
breaks.
main breaks that affect
Yes.
our daycare schools and businesses that we inspect, that we're going to know if they're calling us for the water sample. It would just be
And
another trigger to find out to make sure that they're using bottled water or doing boil water correctly.
The other issue is just making sure that our substance, you got not use NIDEX correct anymore now.
It's COLI tag.
Yeah, Colitag was
Yeah.
same we were using, so
Yeah.
decrease the cost of that.
Yeah.
But it's making sure that everything is current every month and you've sampled every month, meaning you've tested your Colitag every month,
Exactly.
right? And so
Every
that
quarter, yeah,
becomes a cost.
it does. I talked to Clay County, they do it every 3 months.
Yeah.
QC every 3 months,
Yes.
which is the expensive side.
Yes.
I can't remember what I paid, is it $300, I think, our
think
QC's like
so.
$300 or $400.
You have to get all the active cultures in here in order to do it, to retest.
And then Don told me at Laclede County, they have started using their medical refrigerators and freezers because they're automatically logged temperatures and they're certified thermometers, so they're not doing that twice. So it's saving them money on getting their thermometers calibrated and
More expensive up front.
Yeah. And he also told me that they've changed it now to where residential sample is unofficial, no matter who takes it. The only official samples that they're putting out is if it is public.
So you done 17 of them, and that's residential.
Yeah, we average 17, 20 a month residential.
From inspectors.
From whoever, homeowners, inspectors.
Anybody does one.
And what would be you say you're saying $500 to get certified, but what additional cost might be included?
It would be the QC.
The
It's going to be
agents.
The other thing would be, the refrigerator, a better refrigerator that will hold temp.
Well, I think,
Depending on how busy we get, possibly a bigger incubator.
Don't you have to have an autoclave and all that too?
No,
no,
Oh, you don't? Okay.
no, it's
Because we're
not.
only
It's not
doing-
Petri systems. It's
No, it's all.
it's a cavity
one
back
time
system.
you-
Oh, so it's all like that.
and we're just
Okay.
doing total
Have a
cold forming,
heat
so
sealer and all the stuff.
but I
We're
Yeah,
do,
already
it's down
using
there.
one of our refrigerators
Yeah.
to do that.
So there'd be some
she
maybe
just,
possible upfront costs.
she's just using our VFC refrigerator.
with the QC.
Oh,
it's
okay.
just- Yeah, it's too risky it's too expensive to risk a home refrigerator.
So
It doesn't
$300
take
a quarter
Probably
for that. So that's
Quality.
$1,200 a year.
plus
And over,
500.
that's just for the Colitag reagent in order to test.
And the certification, is it annually?
It's an
You
annual.
renew annually?
It's 500. But looking at that, with the water main breaks, all the private labs charge after hour costs and weekend costs.
Yep.
To come in
And we could do that too. The water main
Yep.
breaks we could do differently. I don't see that we would charge them any more than a residential sample on a regular daily sample because it's the same test. So we couldn't go over that, but water main breaks and emergency, just like any of our other emergencies, our prices are higher, just like all the other labs, because we're working after hours.
Yeah, Rolla Lab charges $80
Oh, it's
on the
better.
weekends.
Yeah, it's 8, so it's 50
80.
through the week and 80 on
50,
the
yeah.
weekend. So, but St. Robert told me they would be willing to pay that if they could drive that here
Yep.
instead of going to Raleigh.
And so did all the other, well, the water districts. Matt, he does 5 samples a month.
And I think, if certification's annual, try it for a year and see how it goes.
Yeah.
It doesn't mean we have to renew and continue to be a certified lab
Right.
if the cost is higher.
I think we'll get to water main breaks. I don't think we'll get a lot of the official monthly sampling.
I think you will. I think you'll be surprised.
My only issue is just the P&L statement. I mean, it's just
Because
only question we have is how many.
1,500.
That's what I mean. That's why we
versus
can always try it a
3.
year.
I know you.
I think
I
it
know
would-
you do.
Yeah, I think it would.
They
be
told me,
worth
because
trying
I
for a
talked to
year.
everyone,
Well,
and
they
they
bring
told
them
me.
here already though.
He
You expect
approves
us to
that,
send them to
though.
the state.
I mean, the city of St.
And a
Robert,
lot of people's not using the state lab. I'm telling you.
well, I know Scott told me that they would not be able to pay $1,500 a month.
Now,
When they
you
can
just
pay-
told me the opposite. So
Well, if we're doing that,
So,
then
Scott's not the boss. So I'll just say that.
Well, if we're looking at that and we're doing 30 to 100 samples a week, then our lab's way too small.
Yeah,
We
because
would have
that's
to,
a
I
thermal
mean,
lab, yeah.
Well, you've
couldn't-
got
we
2 more
couldn't-
incubators. You got another heat sealer.
We'd have to,
I mean,
we'd
it
have to
would-
expand it into this back room.
Yeah.
the water
We would have
districts,
to-
like I said, Matt over here at Buckhorn, he does 5 samples a month. Number 2 does 3 samples a month. Number 1 does 3 samples a month. That's just
Well,
one.
yeah, those are pretty small, but when you get into some of the ones that's doing a lot more than
$800
that,
a
like Ridge Creek and I don't know,
You've got a lot of others around here that you really,
That's right.
but
Yeah.
I mean, we'd have to weigh that in because if we're looking at 4,000 for another incubator,
Mm.
I mean, then we're getting into cost.
How many will our hours hold? I don't think it's ever been.
Gosh, I
Yeah,
don't know.
I got one.
if he's got one,
I don't know if I want to overload it.
I just didn't know what
Yeah,
the
because
max
of
was.
how
Yeah.
it has to,
You could
It's
probably,
really small because if you overload it, then it might fluctuate enough that it could throw those off. So,
on an average, you can put how many in there? You just do 1 or 2 at a time anyway, right?
we've done 8,
8. I was thinking around 8 or 10.
yeah, at a time.
So Karen, on the,
But
cost,
also we have to look at, the more we do, the more color tag we go through. So that also, it'd have to offset that because instead of doing keys every 3 months, if we're doing it once a month, it's $300 a month.
because of how much you're going through.
so Karen, on the, cost benefit analysis, and it sounds like it's kind of a break even point. What about, additional personnel to be able to run the function? Is there going to be additional need for, more people, or can you do it with your current staffing?
We would have to use current staffing. We would not be able to make enough money off that to pay.
Yeah, you lose if you had to hire another person.
Yeah.
yeah, that's,
Which Amy's the
I
one,
said,
she used to run a water
the
lab.
water main breaks would probably be what we would be looking at
What?
in the,
She used to work, what was the name of the company she worked?
water lab. I can't,
No,
remember. It's out of Lake.
It was the
Yeah.
lake. It was a private water lab she worked for at the lake.
H2O?
She was a lead.
Yes,
Lake Ozark Environmental H2O?
maybe. I can't remember. Where's it at? Where's
She
it
used to work
located at?
there.
They're in Campton.
That's where she worked there for 10 years. She
Really?
came here, yeah.
Yeah, She
Wow.
worked at
She
one
lived
of
here
them.
though. It was closer for here. That's why the only reason she left is the drive. But she
She
started
here
here
today?
She's
somewhere. She may be in an inspection, but she's
Okay.
around.
That,
What I
that
would-
was the H2O lab. They've done a lot of water samples.
I can't remember the
They-
name of
they-
the lab.
Of course, that's all they do. They're kind
That
of
was
one
what
and
they
all
were
of that. If we charge after hour rates for that, that would cover our time, but to actually hire somebody else. But
We don't pay for it.
I don't know if we would be looking at.
Who are you saying charged $1,500 a month?
Huh?
Who are you saying charged $1,500 a month?
No, Scott told me that if they ran all theirs through the Rolla lab at $50 a piece, it would cost them $1,500 a month.
Gotcha.
They
And
get
they
the
used
state
to.
because they pay their yearly fee and all their sampling's free.
I'm looking at a subscription
oh,
where they just pay. It doesn't, you'll do it. You'll make sure it gets done. And you're cutting their fee. You know,
Mhm.
but if it does
Because
cost
we were kinda waiting
$1,500,
to
if you
do
give it to them for
sample
$1,250, give it to them
see how-
$1,100, they pay you
Well,
every month guaranteed.
They say
There's
they don't,
that-
they're not willing to pay that because they can get to the state for free.
And I understand that.
Because they pay their hookup fee or their.
Okay.
The privacy fee, they pay for it.
Yeah.
They pay for it.
Okay.
It's,
So they
it's
don't
paid
really
up
pay
front.
for- Yeah.
Then they charge their customers a privacy fee once a year, and they pay for that throughout the whole year. We do it at Crocker, everybody does it.
It'd be nice if you could secure clientele every month and you would know
Yep,
where
and that would work.
it would be nice because
Well,
there's
I
a
was just
convenience
told that
there.
they would pretty well do the water main breaks, but not the monthly samplings.
You talk to Scott.
Okay, guys, real
But
quick,
anyway,
Good conversation. There's potential.
Yeah.
I mean,
yeah.
there's potential
Something
there,
to
There is potential.
if we can secure
but I think
ourselves.
we also would have to charge the same price as we do residential during the week because it's.
What do you
that
charge
service, 30.
okay, guys, here's what I'm gonna ask Deborah to do. Want to make sure that, we ask with all things that we do, what customer benefit is there, cost benefit analysis, all this stuff. I would like to put this on our agenda for next month, next meeting, for staff to bring that to us so that, we can look before we leave and make sure we know what we're doing. Sounds like it's going to be a cost benefit analysis, probably.
And I'll get with you on some more numbers.
And bring that,
We leave this whole side, yeah.
because we just need to be able to have all
But
that.
they don't do.
So before we
water
can
main
make
breaks,
jump into it, but
No,
it
but-
sounds like a good idea. But we want to make sure that we're seeing where we're going to go.
Like I said, if we were still up there, I wouldn't even bring it up. We're right here on the interstate. It'd be a big benefit, I think.
No,
Okay.
we're not.
We'll put it on
I do like that idea, though, and I think that would work.
meeting
Okay.
there, so.
Thursday.
Good, Karen, what else you got?
That'll be it, but they'll have the results on Saturday instead of having to wait till Monday. Because right now.
Karen, on
they
the
bring it in on
new food
Thursday.
establishments,
Their
are
results
most of those
coming
still
out
mobile?
One was Bugsy's, was a new coffee shop in Richmond open. Squisitos did come back from Georgia.
Okay.
So it's a mobile unit in St. Robert.
Plus, we're still seeing,
So
we're still seeing an
we're
influx
seeing
of
a lot
mobiles.
of, we did have Smash Burgers come
Yep.
from out of town last week, which I issued a close order on that mobile unit.
Gotcha.
No water.
Had no running water at all.
That was their
And it
hiccup,
was-
eh?
Yes, it was.
Because they have
I made
hiccup in opening.
Facebook, I don't
Yeah.
know.
I don't
But,
know if you did.
no, apparently I did.
Okay.
That, because there's a lot of people wanting their burgers no matter.
No matter if they wash their hands or not.
Yeah,
Hey, it's good.
that's what we were told. We don't care
Understood.
about foodborne illness.
The bun is not good.
Handle the hamburger.
Lettuce
is not good.
That's what we were
Can't
told.
wash them.
But it'd been out for over a week. Apparently their pump had went out.
Yeah.
So
Understood.
they were very
Thank you, Karen.
unhappy, but I told them it's the state regulations, it's our county code.
Like we
So
do.
you have to fix it. And
Yeah.
they got fixed late, like 6 o'clock Thursday evening.
Oh,
And we reopened them Friday. So
where are they located?
they're out of Kansas.
They're a food truck that they set up next door.
Oh, right,
They had
At
3
Bumgar's.
units. Yeah,
the Baumgars, okay.
it was, owner very unhappy in Kansas. Screaming at me, but that's okay.
Thank you, Karen.
That's her.
Sorry,
So,
sucks to be him.
yeah.
Like that's federal code, you have to. have
You
water.
got to.
Mhm.
But it's amazing. They had someone here from Springfield in a heartbeat from the RV.
Installing, eh?
Yep.
So, I want to pass along kudos to Karen and her team for Thursday Food Managers course. It worked out really well. And Amy and Zachary did a really good job. And the internet worked down at our place. And
You
we
all
appreciate that.
passed.
And we have, I had 4 members of the staff there and they all passed the test. So that was really great. So
And then they taught one here on Monday. We had Duke Brothers Hospitality Group had 5 come, I believe.
Great.
And then
They did their
That's
testing.
kicking
They,
pretty good.
Yeah.
Yeah.
We're actually opening in, the first class to be open will be December 4th. We're opening up, it'll be like every Monday or every other Monday, see how many people.
I like
But
it.
we have a lot coming, so.
That's
We have a
great.
lot.
That'd be good.
well, I think it's all about education.
Yeah.
More people that get trained, more managers that understand the process. And then are we looking to do the food handlers course as well at some point?
The basic one,
yeah, they can sign up for that too. They'll teach it as well.
we can. Then of course we just do the proctoring and then, we are a little bit cheaper than ServSafe home loan, so.
Helps out there.
And then Dan, of course, will be doing it in Spanish, which will
Nice.
be.
Oh,
really
Yeah,
good.
when
Love
he
it.
comes on, he'll.
Yeah. That will make a big difference.
That'd be a big difference.
And then I
The,
believe we'll start doing sewer classes next year too.
Yeah.
Really?
So, yeah. We're trained, so, and.
That'll be
and
good.
SO
Yeah, we
is
just
There's
got-
none
we just
available.
offer them, we just have
There's
them.
none available. Sewer
There's none.
dollars.
Yeah.
And they're charging so much for those classes and we can charge a lot less and offer a lot more.
Great.
Even if we're charging $75 a class versus 300 a class.
That'd be good.
Yeah, and it's local.
We need a location for digging and a backhoe.
Yep.
I think you need to make a plexiglass sewer system.
Like up at Springfield.
That was cool. And
It
it's
was
neat
cool.
to see, the water going down through the layers and what system does what and how it
So you're
works.
volunteering to do that?
Are you gonna build that?
Put that together? Did you do that?
I have one.
You have one?
You have?
That's,
Of course he
we
does.
need that here.
I have one.
We need that here. And
It's in our trailer.
do you have drip LPP and conventional?
Yep.
Oh, so can we borrow those
That's
for
cool.
our classes?
That would be great.
I would say we can.
Awesome, thank you.
Well,
That's cool.
it's a really good
It
resource.
is. It really is. It's really easy.
It makes a difference when you can virtually.
Yes,
Yeah.
when you see it all.
Yes.
That makes a huge difference.
Ours is set up too. I mean, we have regular dirt in it and we ran it one time, then you've got to put new dirt and stuff
Yeah.
in, so.
Oh, wow. So
Gosh, there's no real.
I haven't seen it with the dirt in it.
I like, and there was one in Columbia too that was all set up, all sprawled
Yeah,
out on top of the
Columbia had a
ground.
beautiful
Yeah.
one.
I've seen it on top of ground, but not
Yep,
actually
yep,
where you
in
got the
ground.
dirt in there.
So,
That's
anyway,
cool.
good idea, good resource.
Yeah.
That's cool.
But yeah, we're gonna start doing farmers market classes next year too,
Oh, wow.
on if people want to come and
Can,
figure out what they can sell.
are you going to be able to get a special processors from NMU here? Because that would be nice.
We could offer that. We could have them come.
That would be neat.
You maybe
Yeah.
talk to extension.
Yeah.
If they can help.
Yeah.
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 I know that.
Because like we went to that one time, we went to Sedalia
Yeah.
and then MU.
Yep.
We've got the facility. We might as well
Yeah.
Yeah.
do
Utilize
everything we can.
I think MU.
If you happen to catch any of
education.
the extension meets here on Thursday. Yeah, tomorrow night is their monthly meeting and they meet
Very
in
cool.
here.
That is an opportunity. We can offer education and then make some money to kind of help environmental because we're always running in the red. That's really
Yeah.
rough.
You know, talking about, back on the manager's course, the workbook is very expensive.
It is.
So what are some things that we might do as a health department to be able to have maybe those books for checkout or,
Which we do have one. We can order some more. We would have to have a deposit. We could do a deposit if someone wanted
To rent one.
to rent one.
because are we using version 8 or is that the latest? I think version 8 is the latest version.
I believe that's the one
But
that we.
regardless of that, I just think it's
Yeah.
important for us to have a
book
place
for
for people to come
Resource
check
center.
out the booklet or because it's a pretty thick book and it's pretty expensive to purchase, so.
Yeah.
Which we do have one. We do have, I think we also have it on DVD. I can't remember.
I mean, the other option is to look at having some and when they do their class, there's a with a book cost and a without the book cost, maybe if they.
Yeah, because they are
One.
expensive.
Yeah, that'd be kind of good because, I think I'm going to buy a book, for us down at the campground, but just to have for the team down there, but, and the DVDs, I don't know if they're available to be able to refresh with or whatever it may be. So it might be a good thing.
Yeah, I can look at that. I do know the questions on there. You have to really read them because it's the
Try to
way they
trick you.
word them.
There's some trick questions on the test.
Yeah, and there's some questions on the test that are not covered in the class too, as
Yeah.
well. So, just I guess they throw that in just to see,
Just to see if you know.
just kind of
Yeah.
check you out or something, but so anyway, kudos to the team. They did a great job and I look forward for us to continue to do more training and, it'll make us a better county. And, because I don't think anybody wants to, everybody wants to be able to do the right thing. And I think this is part of it, that education aspect. So. Okay, what else?
I don't think that's it.
Very good. All right, thank you so much. Any questions? All right, Mr. Everett, moving down to old business. What do we got?
I did forget something else in my report. We went, Melissa and I went to Dixon Elementary School yesterday for a one sole purpose program. She has fundraised enough to get all of the kids in Dixon a new pair of shoes. And so this year they did it differently. Lone Oak actually donated the tickets and they get a golden ticket and they have certain shopping days. They go to Shoe Sensation. They're providing lunch. And so it'll be December 5th to the 7th. The kids can take their ticket with their parents and go. If they don't have transportation, Shoe Sensation will actually go to the school and take them to their own little store. The counselor will give them some range of sizes they need so the kids can go there if their parents can't get them to the store. And so we did some pictures with our because we have sponsors for a lot of the races that do the fundraising. And then Israel's family had decided that the donations in his mom's memory will be made to one sole purpose.
Oh,
So we thank you guys for that.
So can we get a lot of photographs and maybe a video?
Yeah, so we will, Melissa and I are going to try to pop in over those few days, get some pictures. They will take some. They will get some at the school district if they do the shoes. As part of that program, it's not income based. Every kid gets a pair. So we don't worry about income or if they need them or not. She fundraises enough to get every kid a pair. So thank you for Melissa.
Yep.
How many rounds have you done for Title
Well,
One?
back at Texas, so
So one full round. We've done every Title One. Awesome.
All the Title I schools.
Coats and shoes, big deal.
Big deal.
I appreciate that.
So anyway, I forgot that in my thing, so.
Okay.
So
That
be
was
watching for
big.
those photos.
How did you forget that?
I know, right?
I
I didn't, I it was on my calendar when I was going through all my things. I don't know, I missed it. But anyway, so that was the biggest thing last month.
I like the ticket idea. That was good.
Yeah, and it was a lot for the
It
store
helps logistics.
manager.
It helps logistics.
It does, because she used to have to fill this room with shoes and sort by teacher, and then if the size didn't fit quite right when they got there with that brand, they would have to get back. So the kids can actually go to the store, pick out, and we're promoting physical activity, so it has to be an athletic shoe, so a tennis shoe, and they can go in and pick them out and try on and get the right pair and have lunch on the store. And they also do a sock drive, so every kid will get a new pair of socks or new pack of socks as well. So anyway, they've been a great partner. And Melissa does an awesome job fundraising, because it's 100% fundraiser dollars. So
Big deal, really big deal. All right, thank you very much. How about item number 9? Hold it.
all right. So we've been talking about needing a carport for our RV. So you'll have a sheet. Melissa got them, and Melissa, you may have to remind me. Some of these show, and there's the full quotes there. I just kind of made them a little bit easier to go by. But
Quick question too. Where were
some of them are actually in state, down by the pole, because there's electric down.
there was a lot of them that were in state, but they would go back to somewhere like in North Carolina.
Like the quote would come from
like
a
where
different.
they got their stuff from. It's very confusing to go find out exactly where the metal is coming from. So I got as well as I could find online without actually going.
But some of them look like out of state, but they may have salespeople, or they may have a storefront here, but their quote looks like it's out of state. Yeah. So anyway, they look like they're far away, but not all of them actually are. That's just where their parent company, I think, is from.
Where is this? Where is this Allen's factory outlet?
That's Lebanon.
That is in Lebanon.
There was one in Hamilton that showed it was in North Carolina.
Cardinal, probably.
But they all, even if it is from out of state, they all had free delivery.
And I think you never did hear back from Greens, correct?
No, I sent them 3 different messages about what.
Interesting.
And the place on the North Island Road, they're not in business anymore then, I guess? The place between the last two St. Robert exits, between the 28 exit and the,
You talking about right next to Road Ranger there?
yeah, on the north side, not next to it, but
CB10.
I don't
It's
know.
right
I
there.
don't,
They
I think
did,
you tried them,
so.
because I know that was on the list I gave you, but I don't think the CB10 place.
They may not do metal.
They might not do
I
it.
don't-
They may not
used
do
to.
metal.
I don't think they do like what we need.
No, they
I
had to
think they do
build.
the small buildings. I think they just do
Have
the small buildings. I don't think they do the big carport.
This is a pretty big carport. Well, not compared.
Are we going to space this away from the curb? 12 feet? I'm only asking for future drive-through uses.
Probably not, because it'll end up in the middle of our parking lot. It would probably be sitting
Okay.
across, like kind of how the RV normally gets parked down there, up against, close
Okay.
to it.
Go with
But it'll be open
2029.
on both ends, so we can still drive through it.
Go with 2029. So like,
So is there a reason?
I'm just thinking ahead. Mass vaccination,
Quiet.
drive-throughs. We-
No, it's open on the end, so it can still be driven through.
Gotcha. Okay. Perfect. Good job.
Yeah,
Logistics
it was,
101.
yeah, it's open on both ends. So you
Make
can
your
drive,
building a
you
little
can drive
wider.
through it.
Perfect.
Security wise, I
Maybe
know we
that's what we
mentioned
should do,
putting
is
the
wider
cameras,
building.
Uh-huh.
That way we'll-
because the other carport's gonna have sides. I didn't see it was gonna have sides all the way.
It'll have signs all the way down, just not on the ends.
Right,
You'll-
but you're
you'll be able to
creating
drive
a-
through it.
You're creating a space for someone to get in there and just kind of hang out. Camera, no camera. Then how are we gonna,
So do you want like?
Unless we put a camera inside that carport.
if it's,
What do they
if it
call
can
that?
be reached, it's
Yeah.
gonna get.
What are those new structures called they put in the cities and they're really uncomfortable to lay on along the windows and the door fronts? They're like all spiky and anyway,
What if,
You put it like.
so you don't, so almost don't lay on them. It's just really uncomfortable.
well, what about they have the carports that the walls don't go all the way down to the ground, like, the half, where it'll kind of protect the top, but it doesn't go all the way down.
Yeah, the
I
half,
mean, that's
because all we're trying to do is keep it from
the
what.
top,
hail damage
yeah,
things
and off the
like that.
top. the weather off.
Because the half, because I just know if we got something that's all the way down the ground, all you're creating is a space for a homeless person to get in there and hang out and to do whatever without anyone seeing them. So they could be in there banging on the door and chiseling it open to get in there and just hang out. And do their
So
thing.
you want a motion light, is what you're saying. You're saying you want a motion light. And
I would at least
a motion strobe.
Security wise, at least where it's just half, so you can at least, they're not. they
See
can't
it
just get
and
in there
not
and
all
lay
the way down.
Yeah.
My only issue is that it becomes parachute.
Oh,
Wind gets underneath.
yeah.
It'll lift it.
Yeah.
Yeah, well, even way, if it depends on which way the wind's blowing. I mean, if you got a tunnel right there, if the wind's blowing in whatever direction the openings are, you got a
Fasten
parachute.
down, right?
Mhm.
Can't-
Oh, yeah. You know, that's one thing. How would you fasten? You have to.
I mean, we could do new bids to where it has ends on it with a garage door on each end, so it can still be driven through.
Yeah.
Yeah,
There'll
that's
be big garage
either
doors
fully
there.
enclosed, and we say half, even coming, I mean, you leaving a 2 foot gap is gonna keep people from hanging out in there and camping out and living.
It's also gonna keep us from being able to use it as a drive-through vaccine clinic in the middle of the winter.
That's true.
Yeah, that's true, because that protects the staff.
That's
Like,
kind of one of the reasons why we wanted it completely down to the ground. is
You have power.
If we do a
So can I
drive-through
just ask,
and it's
can we
pouring
put
down
doors
rain,
on each end?
That's what we were
I would
talking
put
Yeah.
garage door.
I would
So he
so
can
love.
rebid and see, just ask him if we close the ends and do garage doors big enough to drive the RV through.
Non-insulated.
What's the difference, like,
Yeah.
what's the cost of adding that in?
We just want the window.
Okay,
'cause
yeah.
When we
Right.
tried to do it,
And even I would
So
do this
we'd have to have lights
Have
in
them
there
bid
too
it.
then?
I always put that lights.
and see what they're gonna charge for those doors, but I'd also call Town and
There's power
Country.
on that pole, so I don't think it'll be hard to get a bid.
I'd call Town and Country and say, with this existing building,
Or do solar.
what you gonna charge to put garage doors on it?
Okay.
Because they may gouge on the garage doors, but Town and Country may do them for half, and you can still do this bid. Have Town and
Just give
Country
it
put
building
garage
and then
doors
they
on
can
it.
put the.
Oh, yeah, and have them put the, yeah, that's a possibility. And have them put the doors in it. Yeah.
Cause they may, you know, it
This
may
is
be,
a pretty good price.
yeah, that's not a bad price. I just, if it's fully enclosed
Put a
over
garage
the end,
door
we're
weight
great.
on an overhead.
I think
That's not rated to hold that.
It's gonna have
And
to be
it's here.
it's gonna have to be the lower one.
That's good.
There are
Yeah.
a homeless family that lives under the road over in the Domino's.
Those are
Yeah,
wait,
Allen's.
they-
It's
over.
There's a big culvert there that I,
Wait,
when the weather's,
but-
they actually, it's not
Right.
letting me.
Close
And
both.
someone homeless,
But
there's no
doors-
on the security side of it too.
But
People
they-
can get in there and they can take a hatchet to the door and no one can
Yeah.
see what they're doing.
That's Allen's.
So it'd just be putting the, yeah.
Yeah, put ends on that.
Enclose both
Put
ends.
the ends so we can put garage doors in it.
Yeah.
So, do have, you know, it looks like if you look at the bid price,
36-inch.
Allen's is quite a bit cheaper than
Mhm.
everybody else.
Mm-hmm.
Is everybody given the same specs?
Yes. That's why they're all the same. The only difference is that wind and snow rating, whatever.
It's their metal, their
Great,
tubing,
their
that's,
metal,
and it's
yeah.
their, yeah, that's their variable, not ours.
So,
The,
See, when I built over in Prague.
but yeah, they're all the same
when we
size,
were gonna-
same tubing
before we
gauge.
decided about-
The other,
Two of them did not provide their sheet.
I was just gonna say.
They didn't
yeah,
provide
they
that in there.
40.
And then, but they did all provide their wind and snow rating
It was the-
for their building. So I did include that. So Allen's actually has, you know,
so what we're gonna
there's
do
those two
is,
that have that highest rating
wanna take a look at
that are the cheapest.
any, you
Oddly
know, the
enough.
garage door situation and any,
We'll bring it
bring
back.
us another.
Yep, we can do
proposal
that.
Next month.
Do you want one 36-inch pass through as well? If you have garage doors, sometimes it's
yeah.
inconvenient,
You
so
might
you just
need
wanna walk in with it.
Add a door in it, a walk-through door for enclosed ends
If
and,
you're gonna do that, put it on this side,
You mean the building side?
Yes.
this side.
yeah, not on the street side, on the building
Makes sense.
side.
All right, everybody good with that?
Do you want us to check all four of
I mean,
these or
put
just the
red
two
door,
lowest
but
bids?
I can see what's coming if we did that.
Yeah.
Check with those two lower ones.
Yeah, I think
Longevity.
Because the other ones are quite a bit higher,
Yeah,
which
they
means
are.
if you add two, they're gonna be quite a bit higher still.
It's
Well,
same,
and- well,
same
the way
type
this-
of building
I don't
as
think
the
you can
other
look
one.
at Town and Country right now.
Yeah,
'cause
they're the same.
Where's that drawing? Let me see that real quick.
Which, Allen's?
Yeah.
Yep.
Because the way they're drawn, there's no sides at all. So see, Town and Country couldn't put a garage door on that.
Right, it would have to be built in for it.
Right. So
It'll end up being,
Yeah,
it'll
I would-
be a
have to do
storage.
additional-
Yeah.
at this point, I wouldn't buy the Town and Country because I forgot they weren't putting the.
Right, we're gonna have to pay for them to put that wall in anyway.
Right. So yeah, forget that. Scratch that part.
Okay.
Okay, so we'll bring back next month, we'll take you out to put it on the agenda for next month.
And I don't know if that building, is that tall enough to put a big garage door in, or are they gonna have to make it taller to make space?
No, if it's, what is it, 10 foot tall?
14 foot.
Oh, that's
It's
plenty.
8, yeah.
Cause that thing's,
I'd call
Well,
it-
the-
what,
I'd
12
call it
foot
that
tall?
camper.
The
14
new
to the
ones, they
peak,
got two different types.
not
you
the
can do.
rakes.
What's those,
That's
it's probably, if it's gonna be uninsulated, you could do
Because
the
it's
roll,
gonna have to be taller than that,
where it just
Oh,
sits
that's
up on
true.
top,
because
and the
It
door
does
just,
peak is 14
the
out of the
door
rake.
just
But the
rolls up.
RV itself
It's 12 foot.
12 foot.
Yeah, but that's, so you look where that
Which I'm sure they'll
the
adjust.
edge is.
Instead of
Is
having
it
to
12
do
foot?
But yeah,
It's a
that's
14-foot wall, 14 foot to the peak. Because
I know what you're talking about.
14
Yeah.
foot to the peak. So you may have to get a 16 foot.
14-foot double legs.
Yeah. So
Oh, you might have
So
to.
you
use
got
the-
walls.
14-foot double legs.
Well, we just need to make sure that we don't want
to the top.
the high voltage to be.
They said the double wide,
Air
so
conditioners or
14.
whatever.
Yeah.
The opening is
I
I just like
14
that might
wide.
affect that price too.
Okay.
So the
If it has
peak
to be
is going to
taller.
be 16.
So like Dave
that
said,
sounds
though, you
better.
have those roll-up
That
ones
sounds-
versus the
yeah,
panels ones
as long
that
as the
come all the way
peak's
in.
14.
How much
That-
space
on the
does it roll
double
up
legs
when
is
you heat at the
14.
top?
They don't take,
They don't take that much. It's just like a bundle like
Like,
that.
These are 14-foot tall wall systems.
because it's already, it's a corrugated
Yeah,
door.
I think the walls are.
So the door,
So the peak is
the
higher.
door will flex because it's corrugated, so it flexes
Yeah.
on the
It's a 12
corrugated
foot,
walls.
it's 12 foot.
And you
but
can
then
just
got
roll it up like a
the air
big roll, and
conditioner on the top will make it.
it may be a
13
roll that
feet in
bigger
the
end,
center, so
but it's having it right over the top of the door, and when it rolls
It
down.
takes less structure.
14 is
Right.
fine, I'm just saying,
Motor and all this.
that has to be on the outside walls, it can't be on the peak, because it's gonna
Do you
be.
need the motors? I mean, you can.
No, I'm just.
It's a 12.
On the Allen bid,
Box is 12
it's
feet.
14-foot
then the air
walls,
conditioner sits on top, which is
18-foot
another
single
foot.
peak.
Nice.
Okay, so that should be fine.
But you will need a 14-foot garage.
Good.
Well, that'll work.
That's a
then.
good buy.
That'll work.
Both ends opening at 18 feet. So,
So we'll just go with
Top
the
of the peak.
prices to close it in.
and the walls are 14 feet.
Cool.
All right. So well, since we're on RV business, how's the RV? We got it back yet?
No, it's still in
Still in the
Springfield.
shop.
So it's
They're
gonna be-
working on the generator. Is it still at Cummings, I think? Or is it moved back over?
It's still coming.
Yeah, it's still at Cummings. They're working on the generator.
They're probably
Okay.
waiting on batteries.
Yeah, I'm sure.
The batteries are not cheap.
No, it's
Oh, they're $675 a
You
piece.
can get them for 600. That's cheap.
All the way to
Wow. Yeah, because they said 2 for 1,300. so.
Okay, so, carport business, we'll bring that back next month. Anything else for carport?
Nope.
Okay, moving down, item 10, new business.
none of your business.
No new business, okay. Next meeting,
It is early again next month. It will be Wednesday, December 17th at 9 a.m. in here.
okay, all
I
right.
won't be here. You won't be here.
Leaving for Germany on the 16th.
So that date again,
Well, you got a phone, you can, you know.
From Germany.
Yeah, why not?
17th, I mean.
It'll be
But they're 7 hours ahead of us.
Yeah. It'll be like, we'll be having breakfast and she'll be having dinner.
Wow. All right, guys, looks like we've completed our business for today. Appreciate everybody coming out. I'd like to pass on to staff. Thanks for all the hard work that you've been doing. Thanksgiving month is coming up. You know, it's a big deal. And we do need to give thanks for all that happens. A lot of the hard work that's gone on this year. Appreciate that. So, all right. Need nothing else, need a motion to adjourn.
Whoa! No, that wasn't a jet engine. That was a water heater that hadn't been serviced since the Clinton administration.
When the pressure relief valve fails, that tank turns into a 400-pound rocket. Seriously, they've gone through roofs before.
All it takes is a little maintenance. Truth, checking the valve, flushing the tank, and keeping that thermostat from running a fever.
So unless you want your laundry room launching into orbit, call Absolute Plumbing before your water heater gets any bright ideas.